What's up, everybody? It's Dr. Michael Hyland here, and this is Wellness Wednesday. And for this live video today, we're going to continue the series on self-treating low back pain, and this is Getting to the Core Part 2. And for several weeks, we've covered this topic, starting with what to do when you first have onset of low back pain in terms of relief positions and in terms of movements you can try to relieve pain and positions you can lie in, things like that. And so we've talked a lot about that. We've talked about spinal decompression. We've talked about positional distraction. And now we're talking about what you can do to not only to improve the back pain, but also to prevent injury. So as we talked about last week, your muscles that stabilize your spine will weaken whenever you have low back pain. And it's an automatic process that you can't really control, except in the sense that you can control that you can control the amount of strength that you lose in those muscles by being proactive about it. So we're going to talk about another way you can work on core musculature. Last week we covered pelvic tilts with contraction of the transverse abdominis muscle. And as a reminder, that transverse abdominis muscle, it's like a built-in back brace. When you contract that muscle, it cinches everything in. And those tendons go all the way back to the lumbar spine, the lower back. So you're literally sucking in everything down there and stabilizing. As a reflex, the multifidus muscles along the spine itself contract at the same time, and those are the deep stabilizers of your spine. So it's a very important thing to remember to do. So again, we did pelvic tilts and we did dead bugs, or that's the common name for them, but it was alternating marches while lying on our back doing having that core contraction. So today we're going to talk about what you can do in different, kind of as a step up from that, as a way to progress, because you don't want to just do core exercises lying on your back. You have to get into ever increasing difficulty to continue that solidifying of those muscles. And so the next step would be to do all fours position, but as a step back even from that, if you do core exercises, core stabilization exercises in all fours position, it's best to start honestly with some form of support on your abdomen, so that especially as you're working on strengthening these muscles that are weakened, that you're not going to injure your back further during that process, because you could strain something or tweak something in your back while you're trying to do this on all fours position. Because a lot of these exercises involve actually, your middle is kind of in a vulnerable position and you're moving your extremities or your arms and legs. So I want to show you a couple of things you can do using an exercise ball. An exercise ball is a great tool to have, and if you don't have one, I'll put a link in the comments down below after the video so that you can purchase one for yourself, especially if you need one for back pain. This one I'm using right now is called the GoFit brand, and this is a good ball that I like to use, so I would recommend it for sure. So the first thing we're going to do, I'm going to have you get an all fours position using your ball. I'm going to back up a little bit so you can see my whole frame. But we're going to lie over the ball, and using that same position, the same contraction that we used last week, pulling your navel or your belly button in toward your backbone. So you're kind of sucking it in. So we're going to hold that position. One of the best ways to start is to just move an arm or to move a leg independently. So arm lifts or leg lifts. So you can't see my one arm, but essentially you're holding that core contraction and then you're lifting an arm as you look straight ahead and then alternating. So you're doing arm lifts. This isn't an extreme challenge for the core because you're really only lifting one limb. If you do opposite arm and leg like so, that's more challenging. So you can see me moving a little bit more because I'm having to stabilize but I would recommend doing 10 to 15, working up to 30 arm and leg lifts. You can start with a leg lift like so and lower down. And I forgot to mention, you want to make sure that you're not arching your back up like this or slumped. You kind of want to find a neutral position in your low back and hold it there. So, neutral position, leg lifts, or arm lifts. I need to back up a little bit, you can't see my arms. Or alternating arm and leg. That's the most challenging. So alternating arm and leg is a great way to do it. And with the support of the ball, you're still going to be working your core, but your low back is not vulnerable. And I'll show you why. If I don't have the ball there, and I'm doing this all fours position, let me move this ball out toward you a little bit. Oh, I just bounced it off the chair. I think that will stay. If you're in all fours position without that support in your middle, it's definitely doable. But starting out, when you're maintaining that neutral position, depending on how much weakness is there, that can really be challenging. I mean, I've seen people drop down like this and just struggle. So starting out, trust me, you're going to need some kind of support, or at least you're going to want to start out that way the first time just to try it out. If it's too easy, then you can always go to doing it without that support. So that's a good exercise to do on all fours, but you can also do another one in sitting, and I'm going to show you that really quick and try to conclude here. But we did alternating marches lying down last week. You can also do them seated on a ball. So this is a good way to do it as well. Because the ball is unstable, and you're trying to keep a stable middle or a stable core. So, like so. So I'm just gonna balance. I'm gonna lift an arm and a leg. I'm holding this solid. So alternating marches. Takes a little extra effort to keep the middle solid because you're wanting to go all over the place like that. So again, same thing, 10 to 15 repetitions, work your way up to 20 or 30. And then when that's easy, move on to something more difficult. And we'll talk about those levels of difficulty as we keep going through the series. As a bonus exercise, one of the things you can do with an exercise ball that's really great early on, especially when you're trying to just get all this area loosened up and you know, because you can have muscle spasms and tight tone and everything. So just doing some, also, you know, pelvic movements are not always intuitive for people. So trying to use a ball to do something like this, where you're doing like hula, you're doing like pelvic like circles, like where the upper body is quiet, but you're kind of moving the lower body like you're doing a hula hoop. That can be great for kind of figuring out how to move the lower half and how to move that pelvic area independently of other things. It's really hard for people sometimes. You can do pelvic tilts forward and backward. I realize that looks kind of awkward on the camera here, but you know, you're basically just doing that anterior posterior pelvic tilt we've talked about. And you can do side to side like so, where you're kind of stretching out this side and tightening that side, and then doing the opposite way like that. So anyway, a lot of great options for using a ball with lower back stuff. So hit me with a direct message if you have any further questions, and be sure to look up this video on YouTube if you missed the full thing. I'll post a link to the video on YouTube once it's published down here in the comments. And as I promised, I'll give you a link to purchase this exercise ball with my Amazon affiliate link if you're interested in purchasing one for yourself. I appreciate you all for taking the time to watch. I saw a couple people jump on, but nobody showed up as far as names. So whoever you were, thank you for watching live, and I will catch you next week for Wellness Wednesday. As always, be empowered.